without further ado, I'll call on Tim Campbell, who's a research fellow in the School of Rural Health, to update us on the latest findings from the psychological impact stream.
Thanks, Michael. And an acknowledgement to everybody who's on the team there on the first page. So what have we been up to recently in the psychological impact stream? We've had two main points of focus in the stream over the previous 12 months. So we've completed some further reporting from the various surveys and analyses that we'd undertaken across both our adult and school study branches of research. And in 2022, we also conducted a third round survey of the mental health of adults in Morwell, as well as a survey of parents of children in the ELF cohort, both of which we're in the first stages of analysing. So recent findings, following on from the previous slide, over the last 12 months, we've published 4 papers, 2 which stem from our 2020 adult mental health survey and 2 from our school study. I'll only briefly summarise the findings on these papers today because we've presented on them before in previous years' engagement sessions. That also gives you a bit of an insight into the sometimes stretched out timelines involved in research reaching final publication. The 2 school study papers collectively, they demonstrate that Morwell students were susceptible to experiencing typically moderate levels of post-traumatic stress after the mine fire. And they also demonstrate that the disruptions that were caused to schooling, caused to schooling by the event had a detrimental impact on NAPLAN performance that was across year levels and also across learning domains in Morwell schools. And what we also found in those studies were that that recovery from that disruption was still ongoing several years later. The adult mental health papers report firstly on a relationship we found between post-traumatic stress levels related to the mine fire and somatic symptoms. Somatic symptoms are unexplained physical complaints. And that finding is useful because it draws attention to how post-traumatic stress can be an underlying factor in the health issues that people present with at, for instance, GP clinics, and that post-traumatic stress needs to be considered when those physical complaints are being investigated. The second adult mental health paper demonstrates how socio-demographic factors shaped long-term post-traumatic stress responses to the mine fire, including how life circumstances such as socio-economic disadvantage, physical and mental health conditions, and recent exposure to other stressful life experiences tended to render people susceptible to both chronic post-traumatic stress trajectories and also to late onset post-traumatic stress trajectories after the mine fire. And the paper also demonstrates how converse circumstances such as having social support and having socioeconomic advantage contributes to resilient responses as well. And then finally, in collaboration with the community wellbeing stream, we're also in the final stages of completing a paper investigating Morwell residents' perspectives on community wellbeing after the mine fire and how these two are related to socio-demographic circumstances. So as mentioned previously, in the middle of last year, we surveyed 226 parents of 260 children who participate in the ELF cohort. And this survey will enable us to investigate how parental mental health and family functioning contributes to the various child health and wellbeing outcomes we've been assessing across the Hazelwood Health Study. In that survey, we administered a variety of assessments of mental health and wellbeing of both the parents and their children, and we also investigated family-wide issues and added some assessments of concerns related to the 2020 bushfire season and the COVID-19 pandemic, so that we'd be able to account for the impacts of those events in our research. We're currently in the initial stages of analysing the survey data, but we anticipate that first results won't be too far away. Likewise, we also conducted a third round survey of more well adults' mental health later in 2022, and that will enable us to conduct a truly longitudinal analysis of post-traumatic stress outcomes, which will span some 8 years since the mine fire. In that survey, we also assessed post-traumatic growth for the first time, and we again included assessments of concerns in relation to the 2020 bushfire season and the pandemic, particularly as these types of events might be trigger points for post-traumatic stress symptoms to emerge. As you can hopefully see in the table, we had another very good turnout for the survey, which is important for our analyses and for being able to draw reliable conclusions from them. And so we would like to particularly acknowledge and thank everyone in the community who's committed themselves to continuing to complete the various surveys we've sent out over the years. So finally, future plans. Our plans for the next 12 months in the psychological impact streams are to complete those analyses stemming from the recent surveys that I've presented, and to begin reporting those findings. We'll also be resurveying parents of children in the ELF cohort in early 2024 to continue our family-focused branch of research.